Hey everybody, Dr. Vince Gutierrez here from movementthinker.org. Today we're going to cover a squat progression, or maybe a regression, depending on how you want to look at it. But it's only going to be a partial squat. Some patients have a lot of trouble with the slow lowering down to a chair, and what we'll find is that they go down, and then it's just like they plop that last 1 to 2 inches. And that's usually an indication of glute strength weaknesses, with the big butt muscle on the back of your thigh, right? What we know is that the deeper you squat, the more these butt muscles become active, and they actually overtake the amount of activity that happens in the thighs. The higher up you come in the squat, right, way up here, you feel a lot of that in your thighs, but as you go lower, a lot of this happens in the butt muscle. And so one way for you to start to get stronger is a partial squat. You strengthen a very small range of motion, and it becomes a little bit more isolated towards the glutes instead of the front of the thighs. One way you can do this is literally initiate, hover, return. Initiate, hover, return. And let's not finish the entire motion for this. The goal is for you to have enough strength for you to be able to hold, relax. Your hands, if your hands go in front of you, they act as a counterbalance. If they come back here, it actually brings your weight a little bit further back, which makes this exercise a little bit harder for you to control your balance. You have to use your trunk in order to lean forward to control the balance. Standing chair is 18 inches. I'd like for patients to be able to get their hip bone below the crease of the knee when they're doing this exercise. So much so that you could take this all the way down to, sorry, I went through those a little bit quicker. You can actually hear the box as I was sitting down on it. But this is about 10 inches, right? So down, hip bone, definitely below the crease of the knee, forward lean, hover, return. Hover, return, hover, return. So if you're looking to get your glutes working more so than the muscles on the front of your thighs, this may be true for people who have knee pain when performing squats, post-surgical patients who they're not allowed to go through the full range of motion during their squat. But if you're looking to get your hip muscles more active, the deeper you go, the more the hip muscles work compared to the thigh muscles. Thanks for watching.